Hello, this video will cover the respiratory system. We left the cardiovascular system talking about the role of the heart and blood vessels to deliver oxygenated blood to the cells of the body and to pick up carbon dioxide from the blood or from the cells of the body and deliver it to the lungs to be exhaled. So the cardiovascular system and the respiratory system really work together on helping our cells get the oxygen and nutrients they need and getting rid of waste. So the primary job of the respiratory system are the gases, oxygen and carbon dioxide. So it's bringing oxygen into the body, allowing it to diffuse into the blood from the lungs, and then the cardiovascular delivers that to the cells. The cells release carbon dioxide as a waste product that is brought back to the lungs, and it diffuses into the lungs to be exhaled. So when we look at the muscles involved with the respiratory system, there's both smooth muscle and skeletal muscle that are involved in respiration. And the skeletal muscle is the diaphragm and the external intercostals. These muscles are under involuntary control, so they're acting without our knowledge, and they are constantly changing the volume of the thorax to allow the lungs to inflate with air and as we inhale, and then deflate as we exhale. So we'll talk about these processes when we get specifically into the mechanics of breathing. So when we look at the general functions of the respiratory system, key thing is gas exchange. Bringing oxygen into the body to enter the blood and allowing carbon dioxide to leave the body through the blood going across the walls of the lung. We can regulate blood pH by changing carbon dioxide levels. We're going to learn in this unit that carbon dioxide levels in the blood, some of that is converted to carbonic acid, and that can drop blood pH. So if someone is not able to exhale properly due to lung disease, carbon dioxide levels can build up in the blood, and that can lead to acidosis and a low pH. So by blowing off extra carbon dioxide, we can keep our pH regulated. So we'll talk a little bit about that. Our vocal cords, as air flows from the lungs out through the vocal cords in the larynx, that produces speech. So we can talk with the help of those vocal cords and moving air past them. Olfaction, or our sense of smell, is when we have air in the environment entering into the nasal cavity and stimulating those receptors, those chemoreceptors in the mucous membrane of the nasal cavity. And we also have several protective mechanisms to protect us from infection from the air that we breathe, because it's definitely not sterile. We have immune cells in the lungs, and we also have cilia and mucus as ways to protect us from infection, and we'll talk about that. So we look at the processes involved in the respiratory system. There's a couple of terms you need to know the specific definitions of. Ventilation is just movement of air in and out of the lungs. So to ventilate someone means to do that for them. So if someone in the hospital is unable to breathe on their own, we put them on a ventilator, and that helps change the pressure and volume to bring air in and out of the lungs. External and internal respiration refers to gas exchange. You can see they both have that term in common, but it's where the gas exchange is occurring. External respiration is when the gas exchange is occurring, and when we talk about that, we're referring to the movement of oxygen into the blood and carbon dioxide out of the blood. So that's external respiration, when those gases are moving between the lungs and the blood. Internal respiration is when those gases are already in the blood and we're exchanging them at the level of the tissues to feed the cells. So internal respiration is not exposed to the outside air, where the lungs are bringing those gases, the oxygen, in from the outside air. So external respiration between the lungs and the blood, internal respiration between the blood and the tissues. So again, this just kind of refers to those terms again, giving a little bit more definition. But cellular respiration, remember, are those chemical processes, glycolysis, Krebs cycle, electron transport chain. That's a different topic. That doesn't refer to breathing in air. It refers to those chemical reactions that are occurring in the cytoplasm and the mitochondria of individual cells. So external respiration, internal respiration is all about gas exchange. So when we look at the respiratory system, we talked a lot about this in lab already. The upper respiratory system is the nose, the pharynx, which is also called the throat, and those structures that we find there, like the uvula, for example, is part of the, it's the start of the oral cavity and end of the nasal pharynx. So we look at some of those accessory structures that help direct air toward the larynx and prevent choking for food entering into the airways. So when someone has an upper respiratory system, we're talking about a lot of mucus production in the nose and the upper airways, and not so much down in the lower part of the respiratory tract, down in the larynx and the trachea, bronchi. So common upper respiratory infections are just people that have seasonal allergies where they have a lot of swelling and itchy eyes, scratchy throat. That's upper respiratory. Bronchitis, pneumonia, those are lower respiratory infections. So when we look at the function of some of these upper respiratory structures like the nasal cavity, we know that it is good for its sense of smell, so we can avoid toxic things in the environment. When we smell something, a noxious smell, we know that we need to avoid that, and we're going to be aware of it. For example, if you have a gas leak in your house, they have added special chemicals to that gas to make it not have an odor, or not, I'm sorry, they give it an odor so you can be aware that there is a gas leaking and you can correct it. So when we look at other functions, then air comes in through the nose. There are factors, chemicals in the nasal mucus cavity, mucous membrane that helps to clean the air. And by trapping it in the mucus, there's cilia in the nasal cavity that takes that mucus with the trapped debris and moves it backward toward the throat to be swallowed and enter into the digestive tract. The mucus in the nasal cavity also has a high amount of water, so that helps to moisten the air that we breathe in so it doesn't damage our delicate alveoli in the lungs, so it moistens, humidifies that air. And it also is a resonating chamber for speech. You know, if you talk to someone who has a really stuffy nose, that changes the quality of their speech. So the nasal cavities, those paranasal sinuses that we talked about in the skeletal system are important for resonating. And if someone has like a sinus infection too, that also is going to give that sensation of a full nose and less resonance when they talk. And the throat is otherwise known as the pharynx. We talked about this in lab. There's 3 different regions of that. Remember, the pharynx is just a common passageway for both air and food. But when the epiglottis covers the larynx and the uvula comes back and covers the nasal cavity, that directs that food down to the esophagus and prevents choking. So our noses produce about a quart of mucus a day. That is a lot of mucus. So a lot of that gets swallowed, and that helps move things for the digestive tract. So that's a good thing. That's okay to have mucus. But you know, if you have a cold and have excess mucus, sometimes that can irritate the digestive tract because there's so much mucus, and people tend to lose their appetite when they have a really bad runny nose cold. We already talked about the cilia. We also have capillaries and blood vessels in the nasal cavity, and that helps to warm the air. So that's the purpose of the blood vessels being right near the surface. A drawback of that is those capillaries can be easily damaged with dry air, and people can tend to get nosebleeds in the wintertime. So sometimes a little bit of saline mist squirted into the nasal cavity can help prevent those nosebleeds. So in the cold weather, our nose tends to drip water because the air condenses in the nasal cavity. That warm air condenses in the cold air outside and causes it to become like water, and then that just drips out of our nose. So that really can't be avoided in cold weather. The larynx is otherwise known as our voice box. That is surrounded by cartilage, and we talked about that in lab, the names of those cartilages that hold it open. And then we have the hyoid bone at the top, and the epiglottis protects food from entering the larynx when we swallow. But that just keeps an open passageway, so we can always move air even when we're sleeping. So that's surrounded by cartilage and keeps a nice open airway. And remember, that opening, that space within the larynx between the vocal cords is called the glottis. So the vocal cords stretch across this space, and that's what allows you to have your voice, and air needs to move outward through the vocal cords to create a normal voice. If they become swollen and when you have a cold, or if they become strained from yelling too much at a sports event or a concert, you know that you can definitely damage the vocal cords, and that can, you know, damage the voice. And singers are really affected by damage to the vocal cords with overuse, and they really have to be careful and take really good care of their voice, because that's how they make their money. And there's a really good YouTube video if you want to look at it. It's part of the Incredible Human Machine series. Steven Tyler from Aerosmith has struggled with having nodules on his vocal cords that needs to get lasered off so he can maintain his voice, because as he's getting older, he's starting to have, you know, some of the effects of all that high and low singing that he does as part of his work in Aerosmith, that he is struggling now and needs those laser treatments to keep those nodules under control. So the vocal folds stretch across the glottis here, we can see, and when we close them, that increases abdominal pressure and does not allow air to come out, and that's called the Valsalva maneuver. So when you bear down, when a woman bears down, for example, to push out a child during childbirth, that's the Valsalva maneuver, and that can cause a drop in heart rate. So that's useful when someone has really high heart rates and they want to control their heart rate. They can bear down by closing the glottis and trying to force air upward, but preventing it by closing those vocal cords. So it's important to know that procedure, but also if a person has already a low heart rate, they don't want to be bearing down, because that can drop their heart rate really low and cause them to pass out. So that's dangerous. And this is missing a V here. This should say Valsalva maneuver. There should be a V between the L and the A. But that is an important thing that is also a reflex when a person has a bowel movement. They kind of reflexively bear down a little bit to help increase abdominal pressure and move the bowels. So that's the glottis, the space between the vocal cords. And when it's closed, that's when we bear down, and that increases abdominal pressure, and we call that the Valsalva maneuver. When we look at the size of vocal cords, the shorter the vocal cords, the higher the voice. So the longer the vocal cords, the lower the voice. So men, due to testosterone, have more cartilage growth in the larynx, and they tend to have a larger larynx. So the glottis is larger, and those vocal cords are longer and stretch a longer distance, and that results in a lower voice. And we see that change in the voice when boys enter puberty, and it starts to crack and squeak because they're adjusting the muscles as that larynx is increasing in size, and it takes a little bit of practice before they reach their final adult size, and those boys have adjusted to the new voice. So we'll pick up in our next video with the trachea.